Good morning and thanks for joining us today. My name is Tracy Lawson and I am the lead broker advisor at Cornerstone. Today we are joined by our partners from Anthem, Kentucky as part of our carrier update series. Before we get started, a couple of housekeeping items. Your phones will be muted throughout the entire presentation. Should you have questions as we go through the presentation, please enter those into the question box and we will address those at the end of the presentation. My information is on the screen if you would like to get in touch with me. And don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. If you are not currently subscribed, please do not hesitate to reach out to your Cornerstone broker advisor for guidance. You may have noticed a new look to Cornerstone's Resource Center. As part of our revamp, we have locked down much of the information that is available on our Resource Center, including our webinar recordings and our news page. It will now require you to register in order to have access to those items. Registration is very simple. If you haven't done so already and need some assistance, please do not hesitate to reach out to your Cornerstone broker advisor. As a Cornerstone broker, you have access to our expert services from the Agency Services Program. This program can help with your business outside of your scope and planning for your future. We help to create a customized plan for you based on your specific needs to ensure that you, your business, and your family are covered. Any questions regarding this program, please reach out to your Cornerstone broker advisor. And now I would like to turn it over to Kathy Crossfield and Lisa Wilson with Anthem.
Good morning, everyone. And thank you all so much for joining today. I think you are going to be really excited about a lot of the changes that we're bringing for 2023 for Kentucky Small Group. We've really listened to your feedback and taken that to heart. So I think everything that we're going to deliver today are good things, and you all will be excited about it, and I think your clients will be really excited about it too. Jess, I don't see my presentation. Let's see. Here we go. Okay. All right. Can everybody see that?
Perfect.
Good. Okay, perfect. Well, we'll get started. Let me minimize my, bear with me a minute. I'm trying to minimize my face so I can see my screen. There we go. Okay, I think we're good. Okay. All right. Well, we'll get started, and if you all see that you all can't see my slides or anything, Tracy or Jess, just let me know. We'll move through here. So we're going to talk about 2023 Anthem of Kentucky Small Group Broker Updates. And just to kind of let you know, I am the Kentucky Small Group Account Executive for Anthem. So I handle new sales, group size 2 to 50 eligible. That is what we consider small group at Anthem Blue Cross Blue Shield. This first slide is our Anthem Link product. Now, it's not new. We put it in, I think, 2 years ago. We're gradually talking about it more in the marketplace, but wanted to just kind of keep it, or bring it back to your all's attention on what the Anthem Link product is. We do offer this product on our Kentucky Chamber Advantage plan guides, our portfolio, and our ACA. But our Anthem Link product is an enhanced, it has a lot of great features, and it's basically centered around virtual care, which is getting definitely more popular in the marketplace. The Anthem Link product is a little bit more unique and a little different than our traditional Blue Access PPO plans and our Pathway HMO plans. It basically is, it's kind of an HMO style. So it doesn't have out-of-network benefits, but it does tap into the high-performance network in other states. And I'll show you in just a minute the states that it branches into as far as providers. So it does have providers in other states, but it keeps the cost down a little bit lower than what our Blue Access PPO plans are. It also centers around the virtual primary care, which is your text chats and your video chats through the Sydney app. And those are at zero cost to the members. So we do promote that, especially through the Anthem Link product. So if you see on this slide, the blue high performance network is what we use for our Anthem Link products. When you're searching on the Find Care link on our Anthem website, you would search under the Pathway EPO network, and in parentheses, it'll say HPN. And that's where you can search the network to see where your providers are going to be. But as you can see these little blue dots on the state, this is where it taps into these states for providers in the blue HPN market in those states. So it is a very great product as far as branching out to other states for a larger network. And again, it is available both on our MEWA and our ACA. So let's get into some of the changes for 2023. On our ACA portfolio, we are putting in a total of 5 new ACA plans. As you can see at a glance, we've got a couple plans that have a $3,000 deductible with a $6,250 out of pocket, zero co-insurance for HSAs, because we know that those are pretty popular. And then we also are putting in a $5,500 deductible with a 20% co-insurance and $8,000 out of pocket. And then in a minute, I'm going to talk about these plans that have WH behind it. These are going to be plans that have an adult dental and vision embedded in 3 of our ACA plan options with the whole health. So I'll talk about that a little bit further in just a second. We're also discontinuing 2 of our link plans. Now, these do not have any membership on it now, so it shouldn't affect any of your clients, but it's the Anthem Link Gold plan and the Anthem Link Platinum Pathway plan. These are going to be discontinued on our ACA portfolio. So let me just talk a little bit about the whole health. So what we've done is we've taken our 3 most popular ACA plans, and we're going to offer them also with the embedded adult dental and vision and pediatric vision and dental. And it's going to be embedded into our medical plan. So when it's quoted, you're going to get one rate, and it's going to encompass your medical, a dental plan, and a vision plan. It's going to have a $180, $50, and $50 deductible with an annual out of max. There's no waiting periods for major benefits. And your endodontics, periodontics, and oral surgery are covered as major. It does use a little smaller dental network than our standalone dental plans for small group. So it's going to use the Dental Prime network. That is the network we use on our individual policies. If anyone sells individual, you all would be familiar with that. But so those are going to be, again, offered on and with the whole health and without the whole health. So if you see the WH behind the plan name, you will know that that has the embedded dental and vision in it. We'll also offer it again without that, and they will be offered with a Pathway HMO network and the Blue Access PPO network. So let's get into some of the updates for 2023. These updates will be for our ACA and our MEWA plans, our Kentucky Chamber Advantage plans. They will be available effective 1/1/2023 for new business and at renewal for existing business. And again, I think you all will be very pleased with the changes that we're making for 2023. So the first thing we're doing on our urgent care benefit, currently urgent care benefits is around $100 copay on our plans now. In 2023, they're going to be equal to the primary care cost share. So whatever the primary care cost share is for the benefit that they're looking at, that will be the same cost for urgent care. And we're trying to steer people from, using the emergency room when not needed. So we're making it a lot more attractive to go to either an urgent care or, again, your primary care physician. Another thing we're doing on our emergency care facility, the co-insurance is going to be removed. So currently on the benefit now, it's a deductible, a copay, and then co-insurance. we're removing the co-insurance. So in 2023 on the emergency room facility benefit, it will be deductible and then copay, which helps people understand, you know, a little bit easier on what their out-of-pocket will be if they have to go to the ER. Another thing we are offering is on the preventive care list. As you all know, we have a list of preventive care that is covered at 100% on our ACA and our Kentucky Chamber Advantage plans, like your adult physical, your pap smears, mammograms, children's immunizations. We are adding chronic conditions to the preventive care list. So there are going to be several services, drugs, and devices for chronic conditions that will be covered in full. And then for HSA, it will be covered prior to the deductible on the HSA plans. Just to give you an idea of what some of those are, it could be hypertension, diabetes, asthma, liver disease. Some of the things that they named were blood pressure monitors could be covered, glucose meters, statins. Some of the other things are beta blockers, insulin and other glucose lowering agents. So those are just some items that would be considered chronic conditions. This is an IRS rule, so you can go to the IRS website to see a whole list of what those chronic conditions would be. And I'm sure we will get more information out to you all as we get that updated. But just keep in mind that we are adding that, or that will be added to our preventive care list. Another thing we are adding is dermatology. So that's going to be covered under your Live Health Online. So if you tap into the Live Health Online website, you can talk to a provider about any dermatology issues, and it will be covered under whatever your specialist cost share is. So whatever your specialist cost share is on your benefit plan, that is what you would pay to see a dermatologist through the Live Health Online video virtual visit. We are also aligning Live Health Online to the same cost share as we do for our Sydney virtual visits. So currently we offer the Sydney app, and if you're not aware of that, I would suggest reaching out to Cornerstone to get some marketing pieces on that, because it is a very great feature for your clients. And the Sydney app is where members can download this app to their phone, and they can see their ID card, they can do a symptom checker, they can go in there and text chat, they can do a video chat. We also, and that currently is at a $0 copay. Also on Live Health Online, currently that's a $5 copay, and we're going to $0 copay. So you can do either or. The members can do either or. They can go through Live Health Online and do a virtual visit, or they can go through the Sydney app and do a virtual visit or a text chat. You just cannot do a text chat through Live Health Online. But we are aligning that with our the same cost share as we do for the Sydney app. And again, that's going to be a $0 copay for them to use Live Health Online. Now, keep in mind, if it's an HSA, they would have to pay, I think for just a primary care visit through Live Health Online, it would be around $59. And then once they meet that deductible, then after that, if they use Live Health Online, it will be a $0 copay. So we went over the emergency room facility, and just at a glance, it's showing you what it is currently and what it's going to be in 2023. We talked about the urgent care. Kidney transplant is also changing. Currently, we cover that under a standard benefit, medical benefit. That's like a deductible coinsurance. And then in 2023, it's going to be covered as human organ transplant benefit. And as long as they obtain, they must obtain the transplant from a Centers of Excellence provider to be covered in network level. Another thing we're adding is emotional well-being resources to our foundational package. So on our ACA and our Kentucky Chamber Advantage plans, we offer a wellness plan that is embedded in both the plans, and it's called the foundational package. And that is, you know, your 24/7 nurse line, your complex care, your condition care, we are also adding emotional well-being resources. And that's going to be more of for depression, anxiety, substance abuse, things like that. And I'll get into that a little bit more in just a second. Another thing we're doing is we are going to put in a wellness program called Engagement Package 200. So this is currently only included in our link plans, but in 2023, to be consistent, we are going to put those in both our ACA and our Kentucky Chamber Advantage plans, and I'll talk about those in more detail in the next few slides. I talked about the preventive care for chronic conditions, so again, that is going to be added and going to be covered at 100%. And then the virtual care, they can either use Live Health Online or they can use the Sydney app, and it's going to be at a 0 copay. So this is not new, but I just wanted to show you all this because I know it can get confusing on what plans we use, what formulary lists we use for what plans, what pharmacy lists we use for what plans. So this is just a slide just to show you on our ACA plans and our Kentucky Chamber Advantage plans, we use something called the RX Choice Tiered Pharmacy Network. That is where you see level 1 and level 2, and depending on what pharmacy you go to is depending on what the member will pay out of pocket. Could be a copay, could be a coinsurance. It also has something called R90. That is where there's a list of pharmacies that will allow members to go in there and get a 90-day supply at their pharmacy. The ACA and Kentucky Chamber Advantage also has something called home delivery opt-in or opt-out. So your members that take a maintenance drug on either one of these plans, if they're taking a maintenance drug after their second fill, the pharmacy and they will get a letter from Anthem stating, we're seeing that you're taking a maintenance drug. You will either need to sign up for the mail order or you will need to opt out of the mail order in order to keep getting that filled at the pharmacy. If they don't opt out, the third fill will not be covered at the pharmacy. It's very easy to opt out. All they need to do is call IngenioRx, or they can go online to their member site and opt out. But if they do not want to do the mail order on a maintenance drug, they do need to let Ingenio know that. Otherwise, they can sign up for the mail order, and that is very easily done. They do get a letter telling them how they can do that. Another thing that we offer, we don't offer what we call the zip drug on either one, the Chamber Advantage or ACA. We only offer the zip drug on the link plan. The link plan, what zip drug is where you can choose a local pharmacy and they can deliver those drugs to their home. That is only available on our Anthem link plans. Also on the formulary drug list, for ACAs, we use the 4-tier select drug list. And on the Kentucky Chamber Advantage, MIWA, we use the essential 4-tier drug list. On the link plans is the select 4-tier drug list. And also, just know on the link plan, the pharmacy list is a little different. It's called the Advantage Pharmacy Network, and it does not include Walgreens or any affiliated Walgreens. And also the home delivery is optional, meaning that they do not have to opt out. They can get a mail order at a maintenance drug at the pharmacy if they like, and they do not have to opt out for not using the mail order. Just want to let you all know briefly that we do offer what we call shop plans on exchange through the Connect site. We do this because if there's any groups out there that might meet or qualify for a tax credit, then they would have to purchase a shop group plan through Connect. These plans are out there on Connect, then parentheses it'll say shop, so that's how you know they're on exchange plans. If someone chooses one of these, it will route them back to Anthem for quoting and enrolling. But just know that they're available, and these plans are also available on and off exchange, just in case you all have any members that reach out to you about those. So let's get into a little deeper on our well-being solutions for 2023. So what is new in 2023 and we're really excited about is our Engagement Package 200. That is going to be replacing our well-being perks and ACA. So currently on our ACA plans, we offer something called Wellbeing Perks. That is going to go away. And again, this is as of 1/1/23 for new business. And when existing groups renew, then they'll change to this engagement package 200. And then also our Kentucky Chamber Advantage Plan is going to have the engagement 200, which in 2022, it only had the foundational package. So this is just a screenshot of what the engagement package 200 entails. It is for employees, their spouses, and domestic partners. They can earn up to $200 each year on digital gift cards. They can monitor this and obtain their gift cards through the Sydney app. So I would definitely encourage you all to talk to your clients about, making sure that their members are familiar with the Sydney app, because again, it is a great tool. But there's 18 ways to obtain the $200 gift cards. Some of them are going to be claim-based, as you can see, flu shot. We just added the dental exam to this, so if they get a dental cleaning, this claim comes in, they can earn $25. And then they have some that are just from wellness, step tracking, taking the health assessment online. All they have to do is update their contact information online. That's $10. Log into our website, they get $5. So very easy things to obtain or to do to reach this $200. And again, this is going to be, we're going to have the foundational package, which is the complex care, the 24/7 nurse line, the emotional well-being that we have added, and they're going to have the engagement package 200 on our ACA and our Kentucky Chamber Advantage plans. I talked about the emotional well-being resources. Again, this is included in our foundational package, included in all our small group plans except for grandmother plans. And it is for a lot of different things. They can, all they have to do is call the number on the back of their ID card, and they can talk to a clinical specialist. They can either text, email, or talk or call, and they can help people out there that are dealing with anxiety, again, depression, substance abuse, all kinds of things. So I think it's a really good resource for them. And this is just, again, on our well-being resources, as I mentioned, social anxiety, which we know a lot of people go through now, depression, COVID issues, things like that. So we talked about virtual care, but just to show you just how popular virtual care has become, we have had 313,000 Anthem members since 2021 use the video visits. We've had 22,000 use the text chat visits through the Sydney app, and 10,000 of them have been for primary care text chat visits. So as you all probably know, primary care physicians are really hard to find nowadays. They're not taking a lot of new patients. We have a lot of young people out there that don't feel like they need to go to the doctor, but it's always really good to have a primary care physician. So they can use the Sydney app to get primary care physician visits through the video chat, or they can just text chat, whatever they prefer. 86% of our consumers who use the virtual visits love it, and 93% of them surveyed said that they would continue to use this. I think it's just making people familiar with it, and again, I think once they use it, they will really love the feature. It's very convenient. Just some things that I want to point out. 1/1 quoting is available around 10/1, so you can start quoting 1/1 groups with ACA and AMEWA around October 1st. Please make sure that you are verifying the effective date, the county, the zip code, the industry code, the census. Make sure that those are accurate when they come in so that we can get you the best rate possible. Want to keep in mind the census threshold rule. We still will allow, if you all send in a final quote, we send you, or Cornerstone sends you a final quote, and you all have some people you need to take off. If it's less than 20% from the time that you got a final quote to the time that we enroll it as a new group, then we will hold the rates. But if you have to add anybody, whether it's a dependent or a member, you have to get that requoted with underwriting for a final quote. So make sure that you keep that in mind when you're talking to your clients. Any census changes at all, when adding someone, it would have to be requoted before it is sold. And also, if it's less than 20% taking people off, we will honor that quote. Remember the bundling discounts, we will give up to 3% off the medical rates if they add dental, vision, life, or disability. That is given at the time of the sale. So if you send the sold paperwork in, once underwriting sees that they've purchased a specialty product, we will send the revised rate back to Cornerstone. They will send that to you. It doesn't have to be signed or anything because the rates will be going down, but know that they can get up to 3% off the medical rate by putting in some specialty products. Keep in mind that it is going to be peak season. Turnaround time can be from 10 to 15 working days. So if a group wants to make sure that they get ID cards in hand by January 1, I would suggest sending in your sold clean paperwork no later than 12/15 to Cornerstone. And again, you know, that is if there's nothing's missing. But we have gotten a lot better every year with the turnaround time, but just kind of keep that in mind with peak season. Want to make sure that you all know that we have put in a second renewal date for our Chamber Advantage plans. We were only having a June 1 renewal, but we have put in an October 1 renewal too. So any groups coming on 7/1/2022 to 12/1/22 will renew 10/1/2023. And that they could get up to a 15-month contract length. And then any groups coming on 1/1/2023 to 6/1/2023 renew 6/1/2024. So they would get possibly up to 17-month contract length. I am going to turn this over to Lisa Wilson. She is the account manager for Kentucky Small Group, and she will go over a few items on the existing business. Lisa?
Great. Thank you, Kathy. Great job. As Kathy mentioned, good morning, everybody. I am Lisa Wilson, for those that do not know me, and I do handle all your existing business group sizes 2 to 50 for the Kentucky market. As we approach peak season, all I wanted to do is give you a few updates and reminders that's just about to come up. Many of you may already be aware that Small Group Kentucky was in a rebate position for 2021. So all your groups, or most of your groups, probably have already started receiving these rebate checks. They receive rebate checks, and with those checks, there was a letter that was sent to them that explained. Also, it was a frequently asked question that was sent to them. We had 3,965 small groups that received or will be receiving rebate checks, and the average rebate check was about $1,600. So if you have questions about that, reach out to your Cornerstone broker advisor, and they can, provide you with some more details, or reach out to me if any questions around that. As we get closer to our grandmother renewals, we know majority of those renew on January. So our January renewals, grandmother renewals, that's also known as legacy, you hear transitional. So when you hear those, they still exist. In our January renewals, both grandmother and ACA are expected to be released the end of October. The average trends for these plans, or a grandmother plan, is 8%. That 8% is without agent. So when you tack on another 1% or so for agent, we're looking at about 9% across the board for our grandmother business. Do keep in mind, groups could get a little bit higher just depending on how they're running. And you may get some groups that are running a little less than the 8 or 9%. Grandmother groups can still make benefit changes. If you go back, Sorry,
Lisa. Let me see if I can go back to that slide. I apologize.
That's okay.
For some reason, it's not letting me go back. Oh.
You should be able to use the arrows on your keyboard to go back. So if you hit the left arrow.
Okay, so sorry, guys. Okay, that's exactly where I need to be. Thank you, Kathy. I just wanted to remind everyone that grandmother groups can still make benefit changes. I know when we first came out with all of this, we could only do downgrades and benefit changes. Well, the great news is we can do upgrade or downgrades as long as they remain in the same product family. So what does that mean? If you have a group on a PPO plan today, they have to make a benefit change on another PPO plan. Same thing with HSA. If it's HSA, they have to remain on an HSA plan if they make a benefit change. We can't go back and forth with the product families any longer. So if you wish to make a benefit change on your grandmother plans, please reach out to your Cornerstone broker advisor and they can help you with the alternate. We get this question every year around our grandmother renewals. Rate relief may be available for some of your groups. Now, Anthem Kentucky is different from Anthem Ohio, and here are a little bit of the rules around Anthem Kentucky. A group must have 5 or more enrolled on the plan before we can even consider them for rate relief. So if you have a group with less than 5 enrolled, the underwriter is going to push back and say, nope, I won't look at it. They must have 5 or more enrolled on the plan before you can send it over to your Cornerstone broker advisor to say, hey, can you go to Anthem and see if I can get some rate relief? Some other criteria around that is it must be a census update. Underwriting pull this information when she generates the renewals. I say about 5, anywhere from 4 to 5 months in advance. So if you have a group that has some census changes in the last few months, definitely please share that with your Cornerstone broker advisor. And medical update. If there's any medical update, someone had a major surgery in the last 4 to 5 months, send that information over. Also, some competitive information. If you share those things with your broker advisor, your Cornerstone broker advisor, they will send that information to me, and then we will reach out to underwriting to see if we can possibly get that rate down for that group. Another way, possibly, a group can get their premium down a little bit. Eligible groups adding ancillary can get up to 3% off their medical risk factor. And what does that mean is I will get a list of all groups that are eligible. I share that list with your broker advisor, your Cornerstone broker advisor, and they will share that information with you. This is a quick tip here. This is mainly for your broker advisor with Cornerstone. This is how to request rate relief. Excuse me. I know this will help me once it comes through, but it also will help your broker advisor. When your group is wanting to look at possibly making a plan change, definitely use these tips. And I ask that you do this. It's because we're in peak season. Emails are going to triple. And when this information is shared in your email, quick quotes is in the subject line, that will allow me to zoom in on those requests and work with your Cornerstone broker advisor quickly and get those excuse me, alternates back to you. So another bullet here on this slide that you're seeing, please disregard any alternates included in the renewal packet. So I talked to you a little bit earlier about groups cannot switch product families, PPO to HSA. Well, because these plans are so old, and they're so old, and our system is generated a certain way, the renewal may generate, and the renewal may have alternates in it. The alternates in the renewal packet more than likely are inaccurate. So that's why we ask that you disregard the alternates included in the renewal packet. Now, when you see them, you're going to see the alternates in it. I did get confirmation the packets that are mailed out to the client, the alternates will be removed. So your client will not see the alternates, but the broker, you will see the alternates. Please disregard those. And again, reach out to your Cornerstone broker advisor and they can get you a quote. Another reminder, if you have a group with a dual or a triple option, and again, we're speaking all around grandmother business. If you have a group that has a dual or a triple option plan before 2014, they can continue to offer that dual or triple option as long as they still fall in the category of 5 or more on the plan for a dual or 10 or more on the plan for a triple. Now, if you have a group today and they only have a single plan and they have 5 or more on their plan and they want to offer a dual option, unfortunately, because these are grandmother renewals, we cannot allow that to happen because that would pierce the grandmother status and we will have to move to an ACA or Chamber Advantage plan. Next slide, Kathy. Thank you. Renewal alternates, a little bit again, speaking on alternates for your groups. To quote an ACA or grandmother group for a Chamber Advantage, also known as MEWA alternate, please reach out to your Cornerstone broker advisor, and he or she will be able to quote these alternates for you via the producer toolbox. Again, the next couple of slides, bullet is really for them that's going out quoting. It just tells them to definitely, when they're quoting, to remember to state that it is an existing piece of business with Anthem and enter that group number. One important piece that I really want to stress on is if you currently today have a grandmother group and you quote them over for a Chamber Advantage plan, I highly recommend, if that grandmother group have ancillary also, sewed with it, if it's like a medical, dental, and vision, and they all on the grandmother plan, and you want to quote a MEWA plan, I highly recommend that you quote all lines of coverage on that. And I tell you, this is the only way to go. This is the only way to go, is make sure you quote the ancillary with the medical, because here's the reason. If you do not, you're going to have the medical on Chamber Advantage, you're going to have the ancillary on another platform, they're going to have two different group numbers, and they're going to have two different renewal dates. And then once that once that group gets that, they're going to probably say, I want to change, I want my ancillary to line up with my medical. The only way to do that is to put it on the same platform. So you will have to move the ancillary over to the MEWA platform, and so they can link up together. So again, I strongly recommend that you quote all lines of products when you're actually looking at changing to a MEWA plan. And most of the time, I guarantee you about 99% of the time, those ancillary rates are going to be less than what they currently offer today on the grandmother platform. And then all zip codes are eligible in the Chamber Advantage program. A few specialty reminders. Bundling discounts. Kathy mentioned a little bit in one of her slides about the 3% bundling discount. Just wanted to touch it, show you a quick little guide here, or a grid to show you groups who choose to move to a Chamber Advantage plan can save on their monthly medical costs. And when they choose like the Anthem Dental, the Vision, the Life, Disability, they can save up to 3% on the Chamber Advantage medical premium. And as you can see, if the group add medical and dental, they'll save 1% on that medical premium. And then they get a 5% for all other lines of coverage, which can be up to 3%. Now, likewise, with our ACA policy, we can't discount on the actual medical premium, but we can discount towards the ancillary premium. But it's all driven by the dental. So if you see the last grid on this slide, you'll get 5% off bundle discount when you buy your dental coverage and you add vision or your dental life. So you can see the grid here, but it's all driven by the dental. So if the group don't add dental and they only add vision, or they add vision and life, this discount does not apply. The dental is the main factor here, and they can get the discount on the ancillary premium. Well, that wraps it up for the existing business sides. So now I'm going to turn it back over to Tracy, and then we can go into the Q&A.
Perfect. Jess, are you seeing any questions out on the chat box?
I am not, no.
Okay, perfect. Kathy, real quick, I do have a question going back to the Engagement 200 package. So two of the components that would allow a member to earn a reward was a dental and a vision exam. Am I correct in saying that that group and member must have in place an Anthem and dental plan, or a dental and vision plan with Anthem? That's the only way to earn that reward?
Yes, that is correct. It does have to be an Anthem product, because it will be claim based, and when the claims come in, that's how we generate the digital gift card. That is correct.
Okay. And then Lisa, one real quick clarification for you on the grandmothered renewals and the rate relief opportunities that are available. I am correct in saying that Anthem Kentucky does not entertain a no shop offer, correct?
That is correct, Tracy, because
Okay.
what we're doing is we're trying to come in as low as possible with these renewals. And that 8% is that single digit, and she's done everything possible for that. So you're absolutely correct. Right now, we are not entertaining a no shop. In order to get
Okay.
rate relief, we will have to have one of those criteria that I walked through to take back to the underwriter.
Okay, perfect. Well, if
And
nobody
we
else
do
has any
actually have,
questions.
we do have actually one question that just popped in.
Okay.
What was the renewal date for groups enrolling 1/1 and 6/1 on MIWA?
And we have a chart that we can send to Cornerstone that they can send out. But if a group comes on July 1st of 2022 to December 1st of 2022, they will renew 10/1 of 2023. If they come on 1/1 of 2023 until June 1 of 2023, they will renew June 1 of 2024. Hopefully that answers your question, but we do have a chart that you can kind of reference to that Cornerstone can send you all.
Yeah, we can get that out to anybody that's on the call today, in case you don't already have that available to you. Okay.
And we did get another question here.
Okay.
When quoting a legacy renewal with a chamber advantage, do you need the updated census or do you quote off of renewal census?
That is quoted, and I don't know if Tracy, if you want to chime in, it's
Yes.
actually quoted just like new business.
Correct. Correct. So we will need a dependent level census for that, and it is very, very important to make sure when that request comes to Cornerstone that you do indicate it is a current Anthem group with their current Anthem group number. If that comes in without a group number, underwriting is going to look at that as a new business, and the underwriting is not done the same. So those rates in all likelihood will not be accurate. So very, very important to include that current Anthem group number.
All right, that's all.
That's it. All right. I want to thank everybody for your time today. Kathy and Lisa, thank you for a great presentation, and everybody have a great day.
Thank you, everybody. Bye.
Bye.
Bye, everybody.